Thank you for watching this exclusive preview of the CME NCPD accredited activity Exploring Novel Treatments for Rett Syndrome, presented by Dr. Timothy John Feyma, Pediatric Neurologist at Gilette Children's Hospital. To bring this meeting to your institution and hear more about how new treatments are transforming patients' lives, please scan the QR code and request a meeting today.
SY is a 5-year-old girl. We'll start with her history as well, just to keep the parallel format here. She was born at term after an uncomplicated pregnancy. Milestones were delayed from the first year of life. So she didn't crawl till 13 months. She didn't walk till 2 years of age. She had minimal verbal development and her vocalizations were minimal. MRI 17 months normal, EEG at 20 months of age normal. She went for consultation with genetics at 23 months of age before she got to our clinic, and they did a whole exome sequencing that did confirm that she had an MECP2 mutation. It's the PR306C. I apologize for the quality of that. That's the best I could do. That's how it was scanned in our system, so I couldn't find the original. So the best I could do was a screenshot of what we had scanned. And that is SY on the right there. Now, for the astute observer of this presentation, you'll see that there probably was a little bit of an early onset development, but she was one of our patients. I mean, so she might have been kind of the infantile onset with a little bit more, but she wasn't severe enough. So we did sort of call her classical Rett syndrome because I think that really fits her best. Because I mean, we really couldn't prove that there was delayed development in the first 6 months of life. And so because of that, we did look at her for some of our other treatment options that are coming online. And so she did have the formal diagnosis of classic Rett syndrome. She continued slow development. She has epilepsy that's continued controlled really well on levetiracetam and lamotrigine. And we also tried her for trofinetide trial. So she tried trofinetide, and she's been on it for at least a few months now. And with that, they've seen more hand use, better attention, more nonverbal communication, and better gross motor coordination. This all seems very qualitative, but in patients who have unique development, a little bit means a lot. A little bit more hand use sometimes makes a world of difference for communication, feeding, opening doors, and function. And it's made a world of difference for her so far. And so she is our longest treated patient so far. So we are watching anxiously to see how she's doing. I'm going to play this video just so that there is a visual representation of where SY is. This is her actually on trofinetide treatment. So it doesn't highlight all the gains that she's gotten, but it highlights kind of how she is overall. She rocks a lot. She has breathing dysregulation at baseline. She hand wrings frequently. She actually can walk around the room. She walks like a lot of Rett girls do. They have this broad-based, wide-based ataxic sort of appearing gait, but she's pretty functional overall.